Breaking news tonight. Shutdowns expand across the country. 75 million Americans now told to stay home. Ground stops today at 4 major airports as an air traffic controller gets sick. And a major reversal in testing for certain cities. Only those hospitalized will get one. Why the vice president is now getting tested. The desperate measures at hospitals across the country. Healthcare workers running out of vital supplies. And the major companies now stepping in to help. The deadliest day yet in Italy, and shocking new video from inside their hospitals. The doctor's message there for Americans here. Inside the government lab racing to develop a vaccine, and the new images of the virus up close.
This is NBC Nightly News with Jose Diaz-Balart.
Good evening. We begin with breaking news. The president's coronavirus task force is promising help is on the way for healthcare workers, many struggling without enough masks, gloves, gowns, and life-saving ventilators. But the supplies are running out. Where will they all come from? And important new information about getting tested for the virus as cases in the U.S. surged to nearly 22,000. The White House now saying not everyone will get one, as yet another state announces drastic measures to stop the spread in the U.S. We begin tonight with Aaron McLaughlin in Los Angeles.
Tonight, on the front lines of the battle against the coronavirus, a stark warning from public health officials in New York. Immediately stop testing non-hospitalized patients for COVID-19, adding patients with symptoms not requiring hospitalization should stay home.
Not every single person in the United States needs to get tested.
Officials point to a lack of medical supplies, saying healthcare resources must be saved to treat the sickest patients.
We are literally scouring the globe looking for medical supplies.
A message echoed in Los Angeles, where officials are telling providers to stop testing mild cases to minimize possible exposures to healthcare workers. This as the vice president announces commercial testing is ramping up, including a new FDA-approved rapid test that gives results in 45 minutes.
You're seeing testing expanded all across the country.
Americans are still lining up to get tested, as more than 80 million people are told to stay mostly at home. Orders spanning 5 states, New York, California, Connecticut, Illinois, and the latest, New Jersey.
It's really hard to feel like you're saving the world when you're watching Netflix from your couch. But if we do this right, nothing happens.
Essential businesses such as grocery stores, gas stations, and pharmacies can stay open. Everything else must close, leading to helplessness and heartache. In Indiana, one restaurant manager had to lay off half her staff.
It was probably the hardest thing I've ever done as a manager. Because there's just nothing I can do.
But COVID-19 shows no signs of slowing down. Nationwide, more than 20,000 confirmed cases. Today in New York, which has more cases than any state, a scare after an air traffic controller tested positive, temporarily halting all flights to New York area airports. In Los Angeles, officials managing the emergency response say the power to beat COVID-19 lies with every American.
The only tool you have right now to fight this virus is people voluntarily staying home.
It's the only thing at the table. If the majority of our population heed this warning, then we will be ahead of the game. I truly believe so.
Aaron joins us now. Aaron, any indication from officials on how quickly these measures will work?
Well, today, Dr. Fauci said, based on past experience, these measures are having an impact. Public health officials say we should see results in weeks. Jose?
Aaron McLaughlin in Los Angeles, thank you. As doctors and nurses sound the alarm on dangerously low medical supplies in the fight against the coronavirus, President Trump announced today that the private sector is stepping in to help. NBC's Kathy Park has the latest.
Tonight, as pleas for personal protective equipment among healthcare workers grow louder, President Trump announced today that help is on the way. Private companies like Hanes and Pernod Ricard will now be producing critical supplies like masks and hand sanitizers. Dr. Anthony Fauci added that the supply shortage should be resolved soon.
We're going to try to make it days to the best possible way we can.
But this comes after doctors and nurses share the reality of what's happening on the front lines.
We know that we have to take care of our caregivers to be able to take care of our patients. And the vast difference in how much PPE we're burning through today than we were last year is enormous.
The Washington Post reporting that dozens of medical workers have tested positive for COVID-19.
I have actually completed the body of the mask.
It's getting so bad in Western Washington, volunteers are sewing masks. And at New York Presbyterian, staff received a letter saying they only have enough to give everyone in the organization one mask. At the University of Nebraska Medical Center, where they're also running low, they're extending the supply through a disinfection process using UV lights.
In normal times, these N95 respirators are used once and then discarded, and we just don't have that luxury right now. So these will allow us to use them 2 or 3 times, and we're conducting assessments to see if we can actually reuse them more times than that.
And it's not just masks. Ventilators are in high demand, too. Approximately 160,000 are available nationwide. But during this outbreak, 960,000 people may need them as their lifeline.
The ventilators are to this war what missiles were to World War II.
Kathy Park joins us now. Kathy, word tonight that another company is stepping in to help.
Jose, that's right. Apple CEO Tim Cook announced that they will be donating millions of masks to healthcare professionals in Europe and the U.S. And in more promising news, New York City is set to receive 1 million masks from the state. Jose?
Kathy Park in Brooklyn, New York, thank you. Many experts believe that having private companies volunteer to help may not be enough. The president has the power to order U.S. companies to respond in a crisis, but he hasn't gone that far yet. Our Kelly O'Donnell pressed him on why.
Facing a medical supplies crisis, the president has a seldom used but powerful authority, one he has discussed publicly since Wednesday.
We'll be invoking the Defense Production Act just in case we need it.
A 1950 Korean War-era law allows the federal government to order private industry to manufacture needed goods like medical masks, gowns, and ventilators, with the government able to control where those supplies go. But President Trump is holding off.
You've talked about the act, sir, but you have not yet compelled any companies. Why not?
We have the act to use in case we need it. But we have so many things being made right now by so many, they've just stepped up.
Instead of ordering them, the president is praising American businesses that volunteer to make supplies, which they can sell to any buyer. Today, the president did use his influence to promote potential but still untested drug therapy for coronavirus.
We don't have much time. You know, we have a lot of very sick people right now in hospitals all over the place.
After tweeting about a pair of drugs used for other illnesses that he called, without evidence, a possible game changer, the president announced a clinical trial using these medications on coronavirus patients in New York.
We're going to find out very shortly whether or not it's going to work. I feel very confident.
Today, Governor Andrew Cuomo embraced the offer.
And health professionals have all recommended to me that we try it.
Dr. Anthony Fauci remains cautious.
That you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and it's not an unreasonable thing to hope for people.
And Kelly, the vice president is now getting tested?
That's right, Jose. Mike Pence says that he and his wife, Karen, will be tested today. That's because a staffer in the vice president's office did test positive and has been home ill for a few days. Now, the vice president says he did not have direct contact with that ill employee and is not showing any symptoms himself. But out of an abundance of caution, he and the second lady are being tested because, of course, he heads the task force on coronavirus. Jose?
Kelly O'Donnell at the White House, thank you. Each day, the death toll in Italy rises by staggering numbers. Today was the worst day for any country yet. Tonight, our first real look inside one of the hospitals desperately trying to save lives. Matt Bradley has more from Rome and a warning. Some of these images are difficult to watch.
Tonight, new images of Italy in crisis. The number of dead surging by 793, a total of 4,825 dead, making this the deadliest day so far anywhere in the world. Corpses wait here for cremation. The morgues are overflowing. 53,578 total cases, turning doctors into heroes and victims. At least 13 doctors have died. Our partners at Sky News visited a hospital in Cremona, one of Italy's worst afflicted cities.
It's a very dangerous, is a disaster, is a tsunami.
Hospitals are overstretched and at their breaking point. Doctors here work 12-hour shifts, only able to rest for a few hours.
We are here for the patients.
The doctors taking every precaution to protect themselves from the disease, changing gloves, masks, and protective clothes and outer layers, trying to keep their distance, but that's nearly impossible. These doctors have to regularly turn patients over to relieve pressure on their lungs. The hospital extending its ICU ward, and it's already full.
We opened this side of the department to intensive care only yesterday, and today it's already full.
Most troubling to doctors, the patients admitted to ICUs are increasingly younger. It's a warning to other countries. The virus can hit anyone.
Don't think that it's happening here and it can't happen everywhere else, because it will if you don't do anything to stop it.
Tomorrow will be a month since the lockdown emptied the streets of northern Italy, but every day comes at an ever higher human cost.
And Matt joins us now. Matt, the government is putting in place even more restrictions for northern Italy.
Yeah, northern Italian officials are clearly rattled by these numbers. We just heard from the governor of Lombardy, who said that starting tomorrow, all public and private offices will be closed, all outdoor exercise will be banned, and grocery stores and pharmacies will have to check their customers' temperatures. Jose?
Matt Bradley in Rome, thank you. Still ahead tonight, inside the Army lab working to stop the virus. Every second is critical for scientists battling coronavirus, but now there's a new hope for a vaccine. Gabe Gutierrez has a rare look inside the Army's race for a cure.
These are the newest images we have of COVID-19, mapped out in a secure government lab where researchers are urgently trying to understand the virus that's ravaging the world.
This is a GPS for vaccine design, so without that understanding, you can drive along a road and you think you're going to the right direction, but with this level of detail, you actually know your destination.
Dr. Gordon Joyce is the chief of structural biology here. For decades, the Walter Reed Army Institute of Research has studied infectious diseases, including HIV/AIDS, Ebola, and MERS. Scientists now say part of the reason this coronavirus is so deadly is that those sharp objects sticking out of this microscopic protein essentially stab patients' lungs.
This is like a hook, and that's what it uses to bind to the lung cell.
Now the race is on to figure out how to stop them.
These different colored objects are antibodies, and the goal is to try to get them to block this protein from attaching to the lungs.
That's correct.
What's happening here is one of many efforts, both public and private, around the globe to find the vaccine. It's a matter of not just public health, but national security. The initial stages of clinical trials are already underway in China, Europe, and the U.S. The first testing of humans with another experimental vaccine began days ago in Washington state.
In some ways, is this a new type of arms race?
I think probably the best kind of arms race in that we're not working in opposition with one another, we're working in collaboration with one another.
But even a fast-track vaccine likely won't be ready for 12 to 18 months. Dr. Sheila Peel is among those trying to learn more about the virus now to better help physicians diagnose and treat it.
This is the most challenging scenario I have faced in my entire career.
A challenge for which the stakes could not be higher.
It's very, very urgent because we know that if we don't do this, that the current pandemic is just going to continue until there are solutions that are effective. And we're doing our best to stop it as quickly as we can.
A global race against time. Gabe Gutierrez, NBC News, Silver Spring, Maryland.
As scientists work to develop a vaccine and effective treatments for coronavirus, there's been some back and forth over common drugs the president says could be game changers in the fight against this. Dr. John Torres joins us now. Dr. Torres, what are these drugs?
Jose, one of them is chloroquine. It's a malaria medication that's been used since the 1940s. And the other is Zithromax. That's a very common antibiotic that's used to treat conditions like strep throat.
Doctor, while these common drugs are already on the market, they need extensive testing to find out if they have any effect on coronavirus. No? How long is this going to take?
You're right, Jose. Just because we know they work for these certain condition, that doesn't mean they're safe and effective against coronavirus. And that's what researchers are trying to find out with their clinical trials. Hopefully these trials will only take a few months, and then they'll seek FDA approval.
So, Doctor, what's your advice for the worried well who are asking their doctors for these drugs protectively?
Best advice is don't ask your doctor for these, don't take these, because number one, we're not sure they're effective, and more importantly, we're not sure they're safe against coronavirus. In the meanwhile, practice what we know works. Wash your hands, don't touch your face, and do that social distancing.
Dr. John Torres, thank you very much. Our coverage of the coronavirus continues. Right after this, we hear from the first member of Congress to test positive, who also happens to be my little brother. Coronavirus has altered our lives in unimaginable ways, impacting finances, family, and the way we work. For me, it's become particularly personal. We learned this week that the first member of Congress tested positive for coronavirus. That person is Mario Diaz-Balart, my little brother. He joins us now via Skype from Washington, D.C. Mario, how are you feeling right now?
Well, I'm feeling better. I think the worst part is past. It's a tricky bug because just when I thought I was over it, or I was pretty close to getting over it, the fever will come back. But again, not as bad as it was originally, and I think hopefully the worst is past.
Talk to me about the symptoms. Do they slowly get worse, or do they come all at once?
They pretty much hit me like a ton of bricks. Saturday, I was fine. Saturday evening, I started getting this amazingly, just a splitting headache, and then pretty intensive fever and a cough. Now, luckily, I have not had an issue breathing, so I've never had a scary moment, but obviously very, very unpleasant with headaches, with coughing, and with a pretty intense all coming at the same time, it seemed.
Self-isolating now for 7 days. What's that been like?
Well, look, I've been busy. I've been working. I've had conversations. I've been on the phone with two members of the president's cabinet. I actually had a conversation with the president himself. Today, I was on the phone with the Appropriations Committee, with the Republican leadership. So I've been working and busy, but obviously all of that right here by myself in total isolation.
Many of your colleagues in the House and the Senate are over 65, some with pre-existing conditions. Should Congress be able to vote remotely?
We clearly have to figure out a way to do this during this very special moment. However, there are some constitutional questions that have to be answered. The last thing we need to happen is we go through this very important package and all of a sudden there's some sort of legal challenge. So again, I know that the leadership, House and Senate, bipartisan, they're looking at ways to make sure that they keep people safe and allow Congress to proceed. So we just got to make sure it's done right and it's done safely, but also that it's done constitutionally.
Congressman Mario Diaz-Balart, mi hermano pequeño, my little brother, thank you.
Thank you, Jose.
And that's NBC Nightly News for this Saturday. I'm Jose Diaz-Balart. Thank you for the privilege of your time. Please stay safe.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.